PCC2 lecture on osteoarthritis, fractures, hips, knee replacement, and gout. Why do we need to know more about these subjects beyond being tested on them? Well, as nurses, we must recognize that the 2019 Census Bureau estimates that there has been a 34% jump of Americans reaching retirement age of 65 years and older. That means we will definitely be caring for patients with these conditions. Unfortunately, elderly patients suffer from fractures from falls and are seen for hip and knee replacements, and they also suffer from the painful conditions of osteoarthritis and gout. Our first subject to explore is osteoarthritis. Osteoarthritis is a progressive deterioration and loss of cartilage and bone in one or more joints. Therefore, the statement on this slide is false because it begins with the word sudden. This is a progressive deterioration and loss of cartilage and bone. Osteoarthritis is a major cause of impaired mobility and disability among adults in the U.S. It is also known as osteoarthrosis and degenerative joint disease, or DJD. There are two types of osteoarthritis. Primary is due to aging and genes, and secondary can be the result of injury and/or obesity. Patients will report chronic pain and stiffness, and pain that diminishes after rest and worsens after activity. Let's look at a couple of patients that come in with signs and symptoms of osteoarthritis. We have a male patient that appears to be in his late 20s, early 30s, and a female patient that appears to be of retirement age. Now, which group do you think would be more affected by osteoarthritis? Many people would choose the older woman, but you really can't eliminate either group. More men than women under 55 come in with osteoarthritis due to athletic injuries, and more women over 55 come in due to childbirth and broader hips. What are the signs and symptoms of osteoarthritis that these patients would report? The general sign would be chronic joint pain and stiffness. Signs of pain depend on whether this is early osteoarthritis or later osteoarthritis. With early osteoarthritis, the patients will report pain that diminishes after rest and worsens after activity. If it is a later stage of osteoarthritis, there will be little comfort with activity or rest. More specific signs and symptoms are crepitus and bone hypertrophy. Now, crepitus occurs when irregular cartilage or bone fragments rub together on passive range of motion. It is like when you crack your knuckles and you can hear or feel crepitus. Bone hypertrophy in osteoarthritis also includes the knuckles. More than half patients with osteoarthritis have knuckles that are enlarged on palpation and with inflammation, indicating a secondary synovitis. Because half our patients with osteoarthritis will experience bone hypertrophy in their hands, let's get more familiar with this specific symptom. There are nodes located on the patient's hands. The distal node is more towards the fingertip, and that is point A on the image, and this is Herbedin's node. The Bouchard's node is closer to the wrist and is considered proximal. These nodes can be very painful and discourage patients from movement. Unfortunately, the immobility can lead to contractures and muscle atrophy. It really is a vicious cycle for the patients. This can happen especially in the hips and knees, and eventually the patient can become extremely immobile. How do we confirm that a patient has osteoarthritis separate from signs and symptoms? We can do this with laboratory and imaging assessments. The erythrocyte sedimentation rate, or ESR, is the #1 laboratory assessment or testing modality. ESR can rise with secondary synovitis, and it also rises with age, infection, and other inflammatory disorders. Another lab work or blood work is C-reactive protein. In terms of diagnostic testing, we can do X-rays, MRIs, and CAT scans. X-rays analyze structural joint changes. MRIs and CT scans are useful for vertebral and knee changes. Because of the nature of osteoarthritis, the progressive loss of cartilage and bone, it can be a very painful diagnosis for patients. Nursing care priority then becomes pain management in order to ensure quality patient outcomes. The primary drug of choice for pain management in osteoarthritis is acetaminophen. As with any drugs we administer to patients, we need to know side effects of the drugs in order to prevent any further complications. We would alert physicians if our patient has a history of alcoholism or liver damage when we are prescribed acetaminophen for the patient. Topical drugs such as lidocaine or over-the-counter aspirin cream, we are applying those to the skin. We have to make sure that we are not applying them to areas of skin irritation that are already there. Or if we see skin irritation developing, we need to stop administering these drugs and alert the physician. NSAIDs, oral or topical, mainly oral, can cause some severe problems for the patient. Side effects include hematemesis or bloody stool, edema, frequent indigestion, and changes in urinary output. Now, glucosamine is an interesting drug in terms of patients that also come in with diabetes and hypertension. And diabetes and hypertension usually go together. Glucosamine has the side effects of increasing blood pressure and blood sugar. So glucosamine is really not a good idea to give to a diabetic patient. Chondroitin is not a definitive drug for pain management, but patients have reported that it has offered them some more mobility in their joints and has decreased their pain throughout the day. Let's test our knowledge of pain management with osteoarthritis in our patients. Osteoarthritis requires a lot of patient education because they will be managing their pain at home. Now, a nurse is providing teaching to an older adult with osteoarthritis and hypertension. What interventions can be advised for temporary pain relief? Are we going to suggest the patient uses glucosamine, takes hot showers and baths, lays supine with a large pillow under their knees or head, or increases their intake of protein and dairy products? The best temporary pain relief to offer this patient would be a hot shower and a bath to ease their joints. Glucosamine is not a good idea, remember, because the patient has hypertension. The side effect of glucosamine is that will it increase your blood pressure. Laying supine is not a good idea with the pillows under the knees or head because those really could cause contractures. If they already have some trouble with mobility, staying in one position with their knees bent, that's not a good idea for them. An increase in protein and dairy products, that really is related to general strength increasing for osteoporosis, not osteoarthritis. Another small quiz about osteoarthritis. Is this statement true or false? Osteoarthritis can easily cause a bone fracture. This is not true. We are actually referring to osteoporosis. And these two terms are often mixed up. Osteoarthritis cannot easily cause a bone fracture, whereas osteoporosis can. So this statement is false.